Pyometra is a life-threatening uterine infection characterized by the accumulation of pus within the uterus under the influence of progesterone. It occurs during the diestrus phase when the uterus is primed for infection and fluid retention. Untreated pyometra can lead to sepsis, endotoxemia, shock, and organ failure. Dogs, middle-aged to older, intact females, commonly 6+ years. Occurs 4 to 8 weeks after estrus. Repeated estrus cycles with no pregnancy. History of exogenous progesterone or estrus suppression drugs. Breeds are not significantly predisposed, though large breeds present more often due to lower spay rates. Cats, less common than in dogs due to induced ovulation. Risk increases in queens who ovulate without becoming pregnant and receiving medroxyprogesterone acetate, and older intact females.
Pathophysiology of Pyometra. Pyometra is fundamentally a disease of chronic progesterone exposure during diestrus. This hormone creates a perfect storm by increasing glandular secretions, decreasing uterine contractions, and closing the cervix. Over repeated heat cycles, this stimulation causes cystic endometrial hyperplasia, CEH. Think of CEH as the fertile soil. It compromises the uterine lining's natural defenses and makes the organ highly susceptible to secondary infection. The infection is typically caused by E. coli from the normal vaginal flora, which ascends into the uterus. As the dog enters diestrus, the cervix closes, trapping the bacteria in that stagnant, nutrient-rich environment. It releases endotoxins that block ADH receptors in the kidneys, causing the hallmark PU-PD.
Open versus closed pyometra. We classify pyometra based on the patency of the cervix, a distinction that dramatically alters the presentation and urgency. In an open cervix pyometra, the cervix remains patent, acting as a pressure valve that allows purulent vulvar discharge to drain. Because of this, drainage owners often notice the issue sooner, and the patients may remain clinically brighter in the early stages compared to closed cases. Closed cervix pyometra is the far more dangerous presentation. With the cervix tightly sealed, there is no discharge to alert the owner, and the purulent fluid is trapped under tension. The uterus distends rapidly, leading to aggressive endotoxin absorption and a critical risk of uterine rupture. These patients progress quickly to shock and septic peritonitis.
Clinical signs of pyometra in dogs. In the canine presentation, the clinical picture often hinges on whether the cervix is open or closed. Obviously, a purulent or bloody vaginal discharge is your biggest giveaway in open cases. But beyond that, you are looking for signs of systemic toxicity. These dogs present with lethargy, anorexia, and vomiting. A crucial red flag to watch for is PU-PD, polyuria, polydipsia. Remember, those E. coli endotoxins block ADH receptors, so a dog drinking excessively with an enlarged uterus is a pyometra until proven otherwise. Physical exam findings range from fever and dehydration to abdominal distension. In late-stage or closed cases, be ready for signs of septic shock, including pale mucous membranes and hypothermia rather than fever.
Cats are notorious for masking severe illness, and pyometra is no exception. While vaginal discharge is a hallmark of open cases, it is frequently missed in cats because of their fastidious grooming behavior. Cats are often presented with a cat that is simply ADR, ain't doing right, or hiding more than usual. You might see a rough, unkempt hair coat from a lack of grooming, weight loss, or dehydration that seems out of proportion to the reported vomiting. Unlike the canine presentation, the dramatic PU-PD is rarely a primary complaint in cats. While cats are induced ovulators, spontaneous ovulation can and does occur. If you have a sick, intact female cat with a doughy or distended abdomen, pyometra must remain at the top of your differential list until proven otherwise.
Diagnostics. On the CBC, the classic finding is a marked leukocytosis with a left shift. However, if neutropenia occurs, this indicates severe endotoxemia. On the chemistry panel, you will frequently see azotemia, which can be pre-renal from dehydration or renal due to toxin damage. Elevated liver enzymes, ALT, ALP, are common due to reactive hepatopathy from the circulating endotoxins. Hypoglycemia in cases of advanced sepsis. Finally, the urinalysis often reveals isosthenuria. Remember those endotoxins blocking ADH, and proteinuria. Radiographs are often your first line of defense, where you are looking for those characteristic enlarged tubular soft tissue structures in the caudal abdomen. Ultrasound is the gold standard diagnostic tool to visualize the fluid-filled, distended uterine horns.
The gold standard, ovariohysterectomy. When it comes to Pyometra, the definitive life-saving treatment is an ovariohysterectomy, OVH. However, anesthesia is risky in these toxic patients, so pre-surgical stabilization is non-negotiable. Need to aggressively correct dehydration and shock with IV fluids and address electrolyte imbalances. Pain management with opioids is essential, as is starting broad-spectrum antibiotics immediately. Ampicillin sulbactam or third-generation cephalosporins are solid choices, while enrofloxacin is excellent but requires caution in growing animals. Medical management is rarely the first choice and should only be considered for valuable breeding animals that are clinically stable and, crucially, have an open cervix. Timely surgery stabilization and good prognosis.